Hi, everybody. My name is Nicolette, and here I am, post op, just like you, a patient. Um, I have lived in Las Vegas, Nevada my entire life, and I've had to navigate the healthcare system just like you, and as I'm doing currently at the moment. Um, and I am building an advocacy uh, business for both patients and providers called MediConciergeLV, and I'm here to help with navigating the healthcare system. It has come to my attention that there is a huge deficit in patient advocacy, patient education. Not everyone is as blessed as I am to have a strong support system. Not everyone has the understanding and the key concepts that I have from my 10 years of experience in the healthcare field. And as I am currently working on being certified as a registered health information technician, I want to start up a business, not just for patients, but for providers too, so that they can create a much higher patient quality of care, patient focused in Las Vegas, Nevada, because I have noticed that with the high turnover rate of medical staff and the unfortunate lack of education quality in this state, there's not always someone there that actually cares. There's not always someone there to explain everything, how it should be explained, easy to understand. And it is not easy to understand. Healthcare is very complex. It comes with a lot of long terminology. It comes with a lot of um, tiny font at the bottom, especially with insurance. I know insurance very well, and I am here to help. So I want to be a key to guiding both patients and providers really start to take healthcare seriously when it comes to treating patients. And I want to help patients who may not have anyone to help them and or have anyone to explain things in a way that they can clearly understand before they're signing away their rights and responsibilities as a patient that they don't quite get. They're paying for things that they shouldn't be paying for. I want to make it very simple for them so that we don't have to have such a low quality healthcare system in Las Vegas, Nevada, where I live. I'm a full time student at the moment, and I am dedicated to making a difference in any patient's life, no matter if that's through education or advocacy or just being there to listen. Because unfortunately, with how certain practices um, book up their schedule for the day, you could be in the waiting room for hours and then talking to a doctor for less than 5 minutes who really isn't hearing your concerns, or maybe you don't know what questions to ask. I want to also provide a disclaimer. This is not a replacement for medical services. I am not a licensed clinician. I will not be giving medical advice in any way. I will simply be there to guide you in how to learn to advocate for yourself. Or if you need me to, I would be happy to, because I know the language and terminology that these offices speak in. And it's a very complicated language. There's a very complicated system set up that deals with data compliance, that deals with HIPAA, that deals with all kinds of things related to medical care. So, this is just my introduction to you. As you can see, I have my membership to AHIMA, which is a certificate of membership to the American Health Information Management Association, and that's who I'm going to be affiliated with once I complete my program. And in the meantime, I want to get this started up and get the word out because I think this is a niche market. especially from what I've heard over the years from patients as a medical assistant, as a call center, taking patient calls, as a medical biller. I have a lot of experience from all different angles of healthcare, especially as a patient, as I sit here today in a sling. And that does not deter me at all, as you can see. Um, I was just discharged a few hours ago, but I feel very confident and enthusiastic, and I'm committed to making this successful, not just for providers so that they can understand how to better understand their patient's needs, but for the patient because clearly there's a deficit and your health is your wealth. Especially if you're on a limited income and you have limited choices in who you can go to, it is very important that you're able to not only understand, but to speak up for yourself in a clear, concise way without any conflict, of course. There wouldn't be any need for that. And it's actually not too hard once you learn the basic concepts to navigate the healthcare system. It's simply just a need for more quality in Las Vegas, Nevada that I want to contribute to. So I want to make a difference in anyone's lives that I come across. I am somebody that goes above and beyond, and it doesn't have to cost you anything at first. I am open to free consultations. I am open to answering basic questions. I mean, that doesn't need to cost you anything. Things that are maybe freely open on the internet for you to look up, but sometimes those sources are not always reliable. Sometimes there's conflicting information online. And Las Vegas, Nevada has a very specialized system in the way that they handle healthcare. It depends always on who you get, who you're talking to, their demeanor, their specific way of handling situations. If there's a disagreement, you never really know sometimes. It is a gamble, as this is a gambling city. So I feel very confident in my ability to answer questions, to provide that information. And if I don't have the information, I will get it to you. So please feel free to explore I have a Facebook business page. I have an Instagram page for my business. I have friends and family that I do this for. I have friends in the healthcare field that agree with me that things are kind of going downhill. And I think there's a way to resolve that because I am a problem solver. I am solution oriented. I I like to get answers if they are not readily available. And I will call as many people as I have to get to the right person, to get down to the bottom of things. Maybe that's a Scorpio in me, or maybe that's just, something that I have a passion for. But there should not be any mystery in your health care. There should not be any mystery to a provider how his or her office is running. And it makes a difference. It does. This is a small city, a small town, if you say. Word travels fast, and it really matters from a patient perspective how they feel treated, how they were made to feel comfortable or not, and that is a key to healthcare quality and advocacy, and that is what my business is about. So again, my name is Nicolette, and I'm happy and here to help. So thank you for visiting my page and listening to me talk for almost 10 minutes, but I really feel lucky to have this opportunity, and you could reach me on my cell. That will be provided to you if you message me privately, and I'm here, you know, just here to listen, here to help, here to educate, here to help patients and providers understand that we need a little bit more in this city for patients to get what they need. So, thank you very much, and I hope you have a happy and healthy day.